Let's discuss something that affects all of us in the manual therapy world. Yes, all of us, including me. The Dunning Kruger effect. Now, if you're not familiar, it's the idea that people with limited knowledge or experience often overestimate their abilities, while those with much more experience tend to underestimate themselves. Now, before you think this is not about me, let me stop you. It is. This applies to everyone at some point in their career, and it's completely normal. But in our profession, it can have serious consequences. We work with people's bodies, we work with their pain, their health. So this isn't something to be casual or careless about. If overconfidence clouds your judgment, it's not just your reputation at stake, it's your patient's well-being. Here's where things get tricky. None of us like to be told we're wrong. It's uncomfortable. It feels like a personal attack when someone challenges what you've been doing, especially if it's something that you've learned early in your training or something you're emotionally and financially invested in. But here's the truth. We've all been wrong before, and that's okay. What's not okay is refusing to learn and adapt because your ego is getting in the way. Now, this problem is amplified massively by social media. So let's talk about the gurus that we've all seen online who spout pseudo-scientific and cling to outdated ideas and promise the world with miracle techniques, 1 million followers on YouTube, brash overconfidence with the secrets to fix everything. They'll tell you they've cracked the code to curing pain or unlocking movement with one magical intervention. They've got flashy videos, dramatic success stories, and a massive following. And the thing is, it looks convincing. But here's the issue. Most of it's rubbish. It's overconfidence dressed up as expertise. And when you look closer, there's no real solid evidence behind it. They throw out big claims, but they rarely have the data to back them up. Worse, they prey on therapists who are just starting out or they're feeling a bit stuck, making it seem like their approach is the only way forward. This is the Dunning Kruger effect in full force. You see it all the time. A lot of these people don't even realize how little they know because they've never properly questioned their own methods. And when you do question them, well, they'll call you closed-minded or accuse you of being afraid of innovation, or they'll attack you personally, reputationally. But let me ask you this. How is it closed-minded to ask for evidence? How is it wrong to question something that could harm your patients or waste their time and money? It's not. It's the responsible thing to do. And here's a key point that I really want to try and make. You are not your techniques. If someone challenges what you do, they're not attacking you personally. We all need to stop taking it so much to heart. The best therapists, the ones that really excel, are the ones that leave the ego at the door. They embrace critical thinking and they keep learning, even when it can be very uncomfortable. And let's be honest, if you're not willing to question your methods, if you're not open to learning or adapting, then you're not just holding yourself back, you're letting your patients down. And unfortunately, that's the harsh truth. And it applies to all of us, no matter how experienced we are. So here's the challenge. Stay curious, stay humble, keep asking questions. Don't just follow the crowd on social media just because someone's got a slick presentation or a big following. Dig deeper, read the research, listen to people who make you uncomfortable because they might just be the ones that will help you grow. And when you see someone online making ridiculous claims, don't just scroll past. Professionally and respectfully ask questions. Hold them accountable. I mean, yes, they'll probably block you, but our patients deserve better, and so does our profession. I've been an osteopath for a long time, and I've had to constantly question an awful lot of the education that was given to me through my degree program. And I am significantly different to when I graduated. I have changed dramatically by questioning and learning with other healthcare professionals. So don't just buy into the hype, critically think, prepare to be wrong. It is not a bad thing. Let's not take it personally. Let's use it to grow. Read the Dunning Kruger effect. It's a really interesting philosophical and psychological concept. Hope you enjoy.